Good day everyone, I am Maricar Sino from BSN 12 for Group 46, and today I will be demonstrate a proper hand washing or hand hygiene techniques. Hand washing is the practice of cleansing one's hands with soap and water to eliminate dirt, germs and harmful microorganisms. In the nursing profession, hand washing holds paramount importance as a fundamental measurement to prevent the transmission of infection within healthcare settings. Proper hand hygiene reduces the risk of cross-contamination, safeguard both patient and healthcare workers, and hold patient safe and overall healthcare quality. Now let's begin the demonstration. First, ensure the availability of necessary supplies such as antimicrobial soap, water, and a paper towel to effectively remove dirt, germs, and contaminants from your hands. Confirm that the sink is easily accessible with running water. Stand in front of the sink. Ensure that your uniform does not touch the sink to prevent potential contamination, and maintain hand hygiene by minimizing contact between your uniform and potentially contaminated surface. Remove all your jewelry, including your watches, rings, and because microorganisms can accumulate in this area. Turn on the faucet with the running water and adjust the force. Wet your hands from your wrist area with finger point toward bottom of the sink. Keep your hands above your elbow at all times to reduce the risk of contamination. Inspect your cuticles, hands, and forearms for any abrasions, cuts, or open lesions. Lather thoroughly with antimicrobial soap. These steps is crucial to effectively break down and remove the dirt, oils, and microorganisms, ensuring comprehensive cleaning and reducing infection risk. Wash your hands and wrist for about 15 to 20 seconds using firm, rubbing, circular motion. Make sure to rub the palm to palm. This process provides comprehensive coverage and friction to dislodge and remove contaminants for promoting optimal hand hygiene. Interlace your finger and rub your palm using the back of your hand at least 5 times each to cleanse the space between the finger. Rub your palm together with your finger. Interlace. These steps aid in cleansing the interdigital space and effective removing the germs and dirt. Rub the back of your finger to opposing palms with fingers interlocked, ensuring true cleansing of the space between fingers. Clasp each thumb in the opposite hand and rotate with the circular movement to clean the thumb surface and surrounding areas. Perform rationally rubbing both backward and forward with clasped finger of the right hand to the left hand and vice versa. This action covers all hands and finger surface, effectively removing contaminants and promoting true hand hygiene. Rub your wrist On the opposite side, hand ensure comprehensive coverage, enhancing to overall effectiveness of hand washing by addressing potential contamination area. Dry your hands from finger to wrist using hand towel or paper towel. This direction drying prevents to spread microorganisms by maintaining controlled moisture, remove and minimizing the risk of contaminating clean areas. Dispose the paper towel properly. Finally, turn off the faucet using the dry paper towel. Keep your hands upright to prevent contamination and allow residual water to drip away without touching potential contaminated surface. Thank you for your attention, and remember that the proper hand hygiene is the crucial practice in maintaining safe and clean healthcare environment. Good day everyone, I am Marker Ciino from BSM 12L, Group 46, and I am here to show you the proper opening gloving throughout donning and doffing procedure. Opening gloving is an essential technique in the nursing profession, enabling the donning of sterile gloves without compromising their sterility for aseptic procedure. This method is critical during wound dressing changes and various medical intervention where infection prevention and sterile environment are imperative. By mastering open gloving, nurses ensures patient safety, reduce contamination, and hold the highest infection control standard in healthcare settings. Let's begin the demonstration. Prior to the procedure, I perform thorough hand washing to ensure my hands are clean and free from contaminants, minimizing the risk of spreading harmful microorganisms. To begin, we need to ensure that the sterile gloves are the correct size, which is we could find here. And always check the packaging of the expiry date, integrity, and tear to maintain the gloves integrity and prevent contamination during sterile procedures. Moisture can compromise a sterile package, and the expiration date indicates the period of sterility. Now, carefully open the outer wrapper of the packaged glove. Separate the side to preserve the sterility of the inner package. This is the inner package. Place the inner package to clean and dry waste label surface. Remember, any sterile object held below waistline is considered contaminated. Maintain sterility by only touching the designated area with your bare hands. Differentiate between the right and the left gloves. Each glove has a cuff approximately 5 cm or 2 inches wide, providing ample wrist and forearm coverage, ensuring secure fit and preventing potential skin exposure during donning. Start by donning the glove on the dominant hand. Use the thumb and the first two fingers of your non-dominant hand. Grasp the edge of the cuff of the glove for dominant hand. Only touch the inside surface of the glove. To maintain aseptic thickness and minimize contamination risk during donning. Gently pull the gloves over your dominant hand, ensuring that cuff remains in the place and doesn't roll up the wrist. Verify that your thumb and your finger are correct position. With your glove dominant hand, slip your fingers under the cuff of the second glove. Carefully pull the second glove over your non-dominant hand. Be cautious not to let your fingers and thumbs of your glove dominant hand touch any exposed skin. Keep the thumb of your dominant hand position away from the rest of your hand. Once the second glove is on, interlock your finger of your glove hands to ensure a proper fit and hold them away from your body above your waist level, maintaining an upright position until the procedures begin. After completing the procedure, it's time to dispose the used gloves. Hold the outside of the gloves with your glove hand and pull it out. Then do in the other hand by putting your two fingers inside the glove. To turn inside out. And discard it on the proper receptacle. Conclude the process by performing a hand hygiene. If you're going to use a hand sanitizer, make sure that you're going to use 5 ml out of it. Mastering the open gloving technique is vital for maintaining sterility, ensuring patient safety, and adhering to rigorous infection control standards. Thank you for your attention, and remember, the critical rule of this practice is providing safe healthcare. Good day everyone, I am Marika Sina from VSN 12L, Group 46, and today I will be presenting a demonstration of the proper execution of Leopold's maneuver. Leopold's maneuver comprises a set of 4 systematic abdomen palpation techniques utilized by healthcare professionals, including nurses, to assess a fetus position presentation and engage within a pregnant woman uterus. These maneuvers plays a pivotal role in determining fetal lie, presentation, and position. This information is critical for monitoring labor progress and making well-informed decisions about patient care. In the realm of nursing, mastering Leopold's maneuvers paramount as it empowers nurses to gather essential data about the pregnancy and contribute to the safe and effective management of the labor. Before commencing the procedure, I have ensured that thorough hand hygiene, and I will be using warm hands for palpation to ensure the patient's comfort and relaxation of the abdominal muscles. Additionally, I have read all the required materials including the stethoscope, a towel, a pillow, and have taken measures to maintain the client's privacy. Good morning, ma'am. My name is Mark Garcia, your student nurse for today. May you state your name and your date of birth, please? Okay, ma'am. Can I see your wristband? Thank you. Today, I will be performing your Leopold's maneuver, which involved placing my hands on your abdomen and carefully identifying specific landmarks. This process allows me to gather critical information about the baby position within your uterus, contributing to a safe and healthy labor process. Is this approach acceptable to you, ma'am? Before we initiate the procedure, I kindly request that you empty your bladder, ma'am. Emptying the bladder beforehand enhances the accuracy of the assessment by minimizing potential interferences or discomfort from a full bladder. This ensures that clearer evaluation of the fetal position and presentation. To begin, I will position you on your back with a pillow under your head and your knees slightly flexed. This position optimizes abdominal muscle relaxation, provides improved visualize and palpation of fetal landmarks, and prioritize your comfort, which is in turn facilities a more precise assessment to fetal position and presentation. Leopold's maneuver comprises 4 distinct palpation steps to assess the fetal position in the utero. Let's begin with the first maneuver. The first maneuver is we called fundal grip. What I'm trying to do here is to determine whether fetal head or branch or buttocks is in the fundus. I will face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the fundus. Always remember that you showed the area that need to be checked. Always remember that the head feels hard and round, freely movable and ballotable, and bridge feels softer and nodular. The second maneuver is called umbilical grip. What I'm trying to do here is to determine the position of the back part of the fetus, which is I'm going to palpate in downward direction on the side of the abdomen by applying gentle but deep pressure to determine the position of the fetal extremities. Fetal back an anterior shoulder, and I will palpate with one hand steady on one side and the other hand explore on the other side. The third maneuver is called Paulick's grip. Determine the presenting part and if engage has occurred. I place my one hand over the symphysis pubis and grasps the lower uterine segment between the thumb and fingers to feel the presenting part. If presenting part is still movable, it's letting us know that it is not engaged yet. Let's proceed to fourth maneuver, which is called pelvic grip. In this maneuver, we have to turn and face the woman's feet. To confirm the findings of the third maneuver and determining the flexion of the vertex into the pelvis. Move the fingers of both hands gently down the side of the abdomen towards the pubis. Palpate for the symphatic prominence, which is the vertex. Prominence on the same side as the small part suggested that the head is flexed. Optimum. Prominence on the same side of the back suggests the head is extended. Now I'm going to locate the back of the fetus and place the stethoscope over it in this and listen to the fetal heart tone for 1 full minute. Normally, fetal heart tone is 120 to 160 beats per minute. Note that the location rate and characteristic of the fetal heart tone. In cephalic presentation, fetal heart tone can be heard in either left or right lower quadrant, abdomen. If the branch, fetal heart tone can be heard above the level of the umbilicus, either left or right. Now I'm going to measure the fundal height. I'm going to place the zero line of the tape measuring on the anterior border of the symphysis pubis and stretch tape to the over midline of the abdomen to top of the fundus. The tape should be brought over the curve of the fundus. The height of the fundus in centimeters equal the number of the weeks gestation plus or minus 2. After 32 weeks, the relationship is less accurate. Okay, after you've done the Leopold's maneuver, you have to put your patient into a comfortable position so this helps to ease and to promote relaxation. Next is never forget to document all the process that you have done to your patient, like documents all the observation made, which is the fetal findings like fetal heart tone, presentation, position, attitude, and whether engaged or floating. All of this is to promote the database for the future. Always remember that documenting is one of the most important to us as a nursing. Thank you very much for listening.